Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. We have a lot of topics today, but including migraines and filial responsibility laws. But before we get there, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter, which is the text for today's video. It has all of the actions, links to medical journals, links to reference materials, as well as a host of healthcare related references at the very bottom of the newsletter. Of course, you can subscribe for free. I want to talk first about migraines. New research has described for the first time how a spreading wave of disruption and the flow of fluid in the brain triggers headaches, detailing the connection between the neurological symptoms associated with an aura, those are the colors that I see when I get a migraine, and the migraine that comes after. The study also identifies new proteins that could be responsible for headaches and may serve as the foundation for new migraine drugs. They would be the target of the drugs. It's estimated that about 10% of people experience migraines, and about a quarter of those have the aura, have a sensory disturbance that can include light flashes, blind spots, double vision, tingling sensations, or limb numbness. These symptoms typically arrive somewhere between 5 and 60 minutes before you get the headache. The cause of the aura is a phenomenon called cortical spreading depression. It's a temporary depolarization of neurons and other cells caused by a diffusion of glutamate and potassium that radiates like a wave across the brain, reducing oxygen levels and impairing blood flow. Now, most frequently, the depolarization event is located in the visual processing center of the brain cortex. That's the reason you get visual auras or colors. I see colors. Anyway, while migraine auras arise in the brain, the organ itself, your brain, doesn't have the ability to feel pain. These signals are instead transmitted from the central nervous system, the brain and the spinal cord, to the peripheral nervous system, the communication network that transmits information between the brain and the rest of the body, and includes sensory nerves responsible for sending information, like touch and pain. The process of communication between the brain and the peripheral sensory nerves in migraines has largely remained a mystery. Who knew? Anyway, the most widely accepted theory is that nerve endings resting on the outer surface of the membranes that enclose the brain are responsible for the headaches that follow an aura. The new study, which was conducted in mice, describes a different route and identifies proteins, many of which are potential new drug targets that may be responsible for activating the nerves and causing pain. The researchers also observed that the transport of proteins released in one side of the brain reaches mostly the nerves in the trigeminal ganglion on the same side, potentially explaining why pain occurs often just on one side of the head in a migraine. I am so hopeful that this is going to come up with medications that really, really work for migraines. When I see the color, it's 2 ibuprofen quick and a quart of water, and then if I'm lucky, in 20 minutes the color goes away and the headache goes away. So anyway, let's talk about RFK Jr. He is a danger to the United States, and I want to talk about that. Scott Gottlieb served as the commissioner of the Food and Drug Administration during the last Trump administration, and he has been on the news lately expressing his concern with picking Robert F. Kennedy Jr. to lead the Department of Health and Human Services because of his anti-vaccine advocacy. He said, I quote, "I think if RFK follows through on his intentions, and I believe he will, and I believe he can, it will cost lives in this country." He said this last week on CNBC's Squawk Box. You're going to see measles, mumps, rubella vaccination rates go down, whooping cough. And like I said, if we lose another 5% of vaccinations, which could easily happen in the next year or two, we will see measles outbreaks, he said. Now, Let me go off the script and tell you, my wife and I live in Vancouver, Washington, a hotbed of the last measles outbreak and now a hotbed of the whooping cough outbreak, because people are of the "you can't tell me what to do," whatever. Put a noun in there. They just don't want to be told what to do, especially when it comes to vaccines. Now, in general, I am ashamed of the names being proffered to lead government agencies. This one in particular, though, is dangerous. And here's the paradox. This is what causes the "you can't tell me what to do" thing. The paradox is that we have had super high vaccination rates in this country for most of these childhood illnesses for so long that people have forgotten that these illnesses, they're just not mild illnesses. They result in crippling, lifelong damage and death. Many, many people who get measles are hospitalized and die. And so people who are not aware of that assert this luxury of "you can't tell me what to do," instead of recognizing that these are disastrous consequences that they foist on their own children and the public at large. I want us to take an action. Send a text message to your senator. It's easy. On your cell phone, send it to 50409, and the message is sign, SIGN, space PBXONF. Sign PBXONF to 50409 to tell them, your senators, number one, no recess so Trump doesn't get free appointments, and number two, absolutely no way on RFK Jr. I'll read you the message. I am your constituent, and I don't want measles, mumps, rubella, diphtheria, or any other preventable illness anywhere in the U.S. These diseases are dangerous and deadly. RFK Jr. will make it easy to not vaccinate, and then children and adults will die needlessly. I know you want every child to have a fair shot. We'll give them that fair shot and reject RFK Jr. And by the way, make sure the Senate does not recess so you get to review every single Trump appointee. Thank you. I'm counting on you. Okay, I want to talk now about filial responsibility in finance. This is an area that we wouldn't have to talk about if we had universal health care. Let me be very clear. We have laws in 30 states related to this, and we wouldn't need any of them, nor would we be burdening children and grandchildren needlessly if we had universal health care. Okay, I want to talk about baby boomers because that's the generation that's retiring. It's the people who were born between 1946 and 64 after World War II. They are now between 60 and 78. Some are retired, some are getting ready to retire. In 2020, 3.2 million of them went into retirement, more than most years. How are they doing financially? The answer is not well. In general, and there are links to these references in the newsletter, a lot of them have very little money. Baby boomers have an estimated retirement savings median, so half above, half below, $194,000 as of late 2023, according to Transamerica. The survey also found, get this, 26% of them have less than $50,000, and 10% have bupkis. They got nothing. That's according to Investopedia. You know what? That's a problem if they don't have enough money. And here's the reason. We're discussing this because there is a move afoot in the U.S. government in the upcoming Trump administration to start cutting social service benefits. They want to cut SNAP, which is food nutrition, for 42 million of us, plus 5 million seniors that don't claim it. They want to cut women, infants, and children nutrition. They want to cut Medicare in such a way that everybody winds up in a Medicare Advantage plan so that the insurance companies become rich, but the care that's offered to Medicare beneficiaries is far less and is more expensive. So you're going to increase costs. You know what? If you're a woman or a child or a senior and food is an issue, you got a reason to worry. If you're on Medicaid, which they also want to cut, or Medicare, you got a reason to worry. Now, because we don't have universal health care, if you're a child or grandchild of someone who's going to have these financial difficulties because of all these cuts, You have to worry. And the reason is filial responsibility laws in the United States can dump that debt right at your doorstep, and you've got to pay it. Filial responsibility refers to an adult child, and in some states, grandchild's legal duty to support parents or grandparents. 30 U.S. states have laws like that obligate adult children to support parents if the parents can't do it themselves. The laws require children to provide for parents' basic needs, food, housing, and medical care. The extent of the care required varies by state. Now, the medical care requirements responsibility is controversial. Funding co-payments for a doctor's visit, that's one thing. But if they have to go to a nursing home or a long-term care facility and all of a sudden there's a bill for $100,000, you know what? That nursing home isn't going to walk away from a bill for $100,000. And if your parents can't pay it, they're coming after you. Unfortunately, the responsibility laws may not differentiate between that copay and that $100,000. But if your parents can't pay it, like I said, you'll be on the hook. Now, these laws are not uniformly enforced in states, nor going back in history. There is non-uniform enforcement, but experts are now predicting a rise in enforcement going forward because of the upcoming cuts and because so many people retiring don't have the ability to pay for care. Filial responsibility court claims are one way that healthcare providers can recoup 5- and 6-figure medical bills that often go unpaid. Now, in some states, laws can apply to grandparents. I mentioned that. It's less common than applying to parents, but it is a possibility, and you should check the laws in your state. I have a link in the newsletter. You can go to it. There's a PDF document that I linked. It shows all 30 states that have filial responsibility laws, and it has the name and number of the law there. And so you can look up in your state and see how much trouble you might be in. The laws can be very different from state to state. I'll give you an example. In Georgia, all it says is that a child who's able to has to support an impoverished parent. That's it. In Arkansas, the law requires the adult child to provide specifically for a parent's mental health needs, but only if the child has the means to do so. And it's not covered by insurance. In Virginia, you and your brothers and sisters are financially responsible for medical bills, including long-term care, but you're no longer responsible if they've been institutionalized for 60 months or more. Who thought of that? I don't know. When are the laws enforced? Now, each state differs in how it works, but there are some commonalities. You're most likely to be deemed legally liable for a parent's medical bills when your parent does not qualify for Medicaid, your parent is impoverished, your parent has medical bills and cannot pay them, and you do have the ability to pay, or your parents fraudulently transferred assets to you. Trust me, it happens. If you live in a state with filial responsibility laws and these conditions apply, you may be legally obligated to support them. If a healthcare provider were to sue a parent for an unpaid bill, the court may just declare that that responsibility now falls on the child. Here are some of the implications of the law. Filial laws should be a consideration in all major financial decisions. So you got to think about this stuff for both you and your parents or grandparents. If you overlook the laws, you do so at your own peril. And I have links to legal websites. Who knows if they're the best, but at least they'll give you information. Number one, here are some of the effects. You can be sued for your parents' long-term care bills. Not likely that they're going to come after that $25 copay. It is likely that they'll come after a $50,000 bill. The best known example of this was a case, Healthcare and Retirement Corporation of America versus Pittis in 2012. Of course, it's Healthcare and Retirement Corporation of America. They are stinkers. Anyway, sorry. At issue was a $93,000 nursing home bill that an elderly patient, Pittis's mom, didn't pay. She got out of the nursing home and she took off. No kidding. She went to Greece. I'm gone. She left her son with a $93,000 bill. Now, the court ruled the son was financially capable and therefore responsible for paying the bill. We'll have more about that case in a minute. You may face civil or criminal penalties. In North Carolina, if you refuse to support your parents, it's a Class 2 misdemeanor. You can earn yourself a 60 to 120-day jail sentence. Have a good day. Financial transactions between you and your parents could be scrutinized. The court may investigate your recent financial transactions to check for any suspicious or fraudulent activity that could indicate you're trying to get out of your responsibilities. Property transfers are likely to be scrutinized, as those transactions might be deemed fraudulent conveyance, which is a property transfer that's intended to defraud creditors. For example, if you own an extra home and you decide having that extra home shows you have too many assets, you give it away to a friend so that your assets look smaller. The court can actually turn that around and find you liable. In some places, you might wind up in jail. You don't want this stuff. And of course, you may have to, this is a sad one. Not only could you be sued, and not only could you have your wages garnished and your bank account seized and all that horrible stuff that goes with debts and liens placed on your property, all kinds of things. You may have to sue your brothers and sisters to get them to pony up to help. It turns out, remember that Pittis case in Pennsylvania? The court said, well, you can just sue that one guy. But it turns out he had relatives who were equally liable for the debt. The judge just said, nah, that guy alone. It was up to him to have to go and sue his brothers and sisters to try and get the money. Anyway, what's the answer to all of this? What are you going to do? Well, first, if we had universal health care, let's say it again, we wouldn't even be having this discussion. However, we're in this situation now, so we have to do something. Number one, plan. Start having conversations with parents and grandparents. It's going to be awkward. You're going to talk about how much money they have, excuse me, what kind of insurance, what kind of assets, and you're going to figure out what kind of bills they may need. You're going to have to figure out if you're in the danger zone for actually picking up their bills. Can they qualify for Medicaid? Is there a way to do it? If you're in the danger zone where you might be hit, you got to find out what your parents' plans are, and you have to take care. Long-term care insurance, that might be an answer. It's expensive, but it might be an answer. Permanent life insurance that can be cashed out through a life settlement, that might help. Home equity could be cashed out. Reverse mortgages, there are all kinds of things to consider. All of them have risk, so think about them carefully. You might want to collaborate with other family members. If your parents or grandparents haven't made plans for long-term care, that's a cue to round up your siblings and have a planning conversation. You know what? I don't often recommend talking to a lawyer, but consulting with an elder care attorney, someone who deals with this every day, whether your siblings want to participate or not, you go talk to them and figure out what to do. They can actually figure out a way to help with long-term care and with Medicaid qualification. That's a big deal. You know, if they get on Medicaid, Medicaid will pick up a lot of the slack and reduce your liability. If they can legitimately qualify, that dramatically lowers the risk. There are legal ways to lower their income and assets enough for them to be eligible should they need long-term care. These strategies are called Medicaid spend down. And you know what? You got to be so careful that you don't do it in a way that the court reverses it. That's why you need a lawyer. Anyway, you need expertise on elder care. Go talk to an elder care attorney or financial advisor that you trust who knows this part of the law and develop a spend down strategy. Look, this doesn't cover everything. This is just a primer in this part of the law. And this part of the law, it wouldn't be here if we had universal health care. So this is one of the problems universal health care fixes. Okay, down below, like, share, subscribe. I love to hear from you. I really do like to hear from you. You can send me things you'd like to have researched. You can also contact me at healthcareadvocacy1@gmail.com. Have a good evening.